So, good morning, everyone. And today we're going to be covering the vitality domains. And in the particular domain today, we'll be talking about is our physical vitality. And so, when we're talking about the physical vitality, we're focusing on that our physical beings, our overall well-being, our sleeping, our eating, our exercising, anything that will pertain to us being physically stable and just physically being in that state where we're able to be mobile and do things that are active and healthy for our lifestyles. So when we're talking about the domains of vitality, even though we're not going to touch on the other ones today, but I'll just go over them for you. They are the physical domain of vitality, which is what we're covering today, mental and emotional vitality, our spiritual vitality, financial vitality, environmental, and social. And everything we do in our daily lives, it all ties in together. So whether we're talking about our mental being or how we feel, how we're feeling right now, how we're dealing with things, how we're controlling our feelings, our emotions. And during this time, we might have feelings and emotions that are, all over the place. We might be sad for one moment and happy for the next, or it might be our spiritual vitality. How are we taking care of ourselves spiritually? What are we doing? Are we practicing mindfulness? Are we using our coping skills? What are we focusing on to take care of our spiritual being on the inside to make sure our outside is doing well? And then with our finances, if our money isn't right, we're not right. A lot of people are a little upset right now about these refunds or stimulus packages that are coming out. People are waiting on that money. When you're expecting your paycheck, you're waiting on that paycheck or whatever money it is that is due to you. So financial vitality, making sure we're taking care of our finances, making sure that we have the money to take care of ourselves and get the things that we need. And if our finances aren't right, again, we're not right. So financial vitality is one of our domains that we will cover, not in today's session, but we will talk about it and how to make sure that those finances are where they need to be so that our overall well-being is well and healthy. Also, our environmental and social. Environmental, the places we go, the environments we're exposed to, whether it's at our home or someone else's home, or just out with people in the community. But our environment, making sure the environments that we're in are healthy for us and we're not in places that are not really good for us or not helping us out overall. And then our social vitality, making sure we have social support. We're with people who are healthy for us, not toxic people, not people that are going to you in relationships you have a give and take. You're giving into the relationship and you're able to get something from it. Making sure you're not in those relationships where you're giving your all and no one else is giving anything and you're being drained, you're losing yourself. And making sure that those social connections you have, the people you're in contact with, are actually healthy for you. They're going to help you and not take away from you or not cause any harm to you. So those again are our domains of vitality. And today, again, we're going to talk about physical. We're going to start at the top and talk about our physical vitality. So with everything that's going on now, people are in their homes a lot more, so maybe you're not out and about as normal as you used to be, but even if you're staying in or you're kind of limiting your outings, you can still take care of your physical vitality. You can still move around, you can still do things, do things that are going to give you strength and stamina, flexibility. Move around, do exercises in your home, making sure you're eating right, taking care of yourself, because what we eat is going to affect how we feel, how we look. It's going to affect our overall being. So eating right, sleeping, making sure you get the proper amounts of sleep, Also, if you're being free of disease and illness, if you're feeling sick, make sure you're following up on that, talking to your medical professional. If you have medications you're supposed to be taking, make sure you're taking your medications. And again, that eating and sleeping, if you're taking medications, that all comes into a play too, because you want to make sure you're eating correctly and you're sleeping right and you're drinking enough water and fluids and things to if you are taking medicines, to kind of go with that. You don't want to take your medicines unless you're told to on empty stomachs, or you're not without the proper fluids. But even if you're not taking a medication, make sure you're still eating right. Not overeating, because that can happen too. Not overeating, not eating things you're not supposed to be eating. If you know that maybe you have diabetes and you're not supposed to eat more than a certain amount of a certain food in a week or a day. Don't go out of that range. Don't overdo it. If you're engaging in physical activity, if you're moving around, you're doing exercises, make sure you're okay. Your body is up to it. Don't overwork your body. And it's okay to talk to your doctor if you're under a doctor's care, and make sure that whatever exercise you're doing is safe and you're not causing more harm to your body. And also, and going back to like the eating and drinking, make sure you're keeping yourself hydrated, you're drinking fluids, eating right. If you're drinking alcohol or using tobacco products, smoking, or anything like that, make sure that, if this is a goal, we're in a new year, maybe you have a goal to limit that or to stop drinking or smoking. Make sure that you're taking care of yourself. Make sure you're checking on yourself, because especially now that we're dealing with COVID-19, those are some of the risk factors. If you're smoking, or you have underlying health conditions such as diabetes, asthma, high blood pressure, and things like that, make sure you're taking care of yourself. If you feel that you're not feeling well, let someone know. Follow up again with your doctors and take care of, just take care of yourself. So some of the things that you can do, we talked about eating right, eating healthier foods, watching what you eat, what you drink, making sure you get sleep, the right amounts of sleep, not too much sleep, and then you don't want to move around, and again, you're not being physically active, but making sure you're balancing out your eating, sleeping, and movement. So make sure you're eating enough, you're sleeping enough, and you're moving enough. Not overdoing it, not doing too much to cause any stress on your body or anything like that. And again, since we are in the COVID-19 this pandemic, you don't want to be out in large crowds if you can avoid it. So if you are going to a gym, take the proper precautions, follow the guidelines that are being issued. If you're working out in groups, again, just take precautions, okay? So what are some of the things you can do right now to take care of yourself? Eat right, sleep right, make sure you're drinking enough fluids to keep you hydrated. If you're feeling sick, let someone know. Stay home, take care of yourself, go into the doctor if you need to. Wash your hands. Make sure we're washing our hands. And you might think, well, what does that have to do with my physical being? Wash your hands. If we're washing our hands, we're taking away germs and dirt, things that can make us sick. If we're touching our face, touching food, touching different items. So wash your hands with soap and water. Wash them often. If you can use hot water, warm water, make sure you use that, and lather your hands up really well. Clean your hands well and dry them completely. Make sure you don't have water left on them. Dry them completely. Cleaning up behind yourself, making sure you're keeping your areas clean, especially things you touch a lot, like your doors, your keys, the remotes in your home, your cell phones, anything that a lot of people generally would touch. Make sure you're kind of taking a cleansing cloth, disinfecting cloth, or spray and cleaning up, just making sure you clean those areas. Wash your hands, clean everything, and once you clean with all the cleaning products and disinfecting products, make sure you wash your hands again, because you don't want to put those chemicals and things into your body if you're eating or drinking. So make sure you're washing your hands, taking care of yourself, and just make sure that whatever it is, if you're noticing changes in your body, if something feels out of the norm, something's not feeling right, let someone know. And so if there is something wrong, someone can help get you the care that you need. But make sure you let someone know. Communicate often, especially if you're living alone, make sure you're reaching out to someone, or someone is reaching out, checking in on you. But stay in contact with someone. If you're living in the house with others and you feel sick, maybe isolate yourself if you can. Put yourself in a bedroom and watch your symptoms, make sure you're okay, and just try to avoid spreading any germs or illness to others, and ask that they do the same if you're sharing a home with others. If you're sneezing, we're at in the winter months where there's cold and flu season as well. So if you're sneezing, make sure you're sneezing into Kleenex or tissue, something you can throw away, and wash your hands again. Once you do that, sanitizers, hand sanitizers. If you can get hand sanitizers and you're not where you can wash your hands at the moment, use a hand sanitizer to clean your hands and keep them clean. Also, with your vitality, your physical vitality, is just making sure that you're taking care of your body, making sure that if you have any health conditions, you're maintaining appointments. If right now, a lot of people might be still somewhat nervous about going in and out of different places. If you have some concern or fear about sitting in the doctor's office, talk to the doctor, talk to their staff. And most places will let you sit in your car and wait until they call you in. But don't miss appointments. If you need those appointments, don't miss out on those scheduled appointments. Or if you have to make an appointment because you're not feeling well, don't skip appointments because of concern or fear. Just talk to them and see how you can work around the social distancing. But again, remembering to follow guidelines. Follow the guidelines set in place to keep everyone safe and healthy. If you're visiting with friends and families, wear your mask. Make sure you're keeping your mask on, covering your nose and your mouth. Not wearing it under your chin, or where you can just pull it up and down when you want to talk and all of that. Make sure the mask is covering your mouth and your nose at all times. Even if when you're riding around in vehicles, if you don't know if you're sick or the other person's sick, keep your mask on and protect yourself and others. And just make sure you're following guidelines again, and washing your hands and staying safe. So one of the other things about physical vitality is making sure that you're kind of pacing yourself. Again, not overworking yourself, not overdoing things, but pacing yourself. This is a new year. Maybe you started out the new year with different plans and goals that you wanna reach this year. But take things step by step. Don't jump into it and then you get burnt out, or you feel like you failed because maybe you said you weren't gonna drink any sodas for a week or a month, and maybe you slipped up and you had one. Don't rule it out, just start over. We all make mistakes, but take things slow, and remember that no one is perfect. So just focus on taking care of your overall health and well-being. Focus on what's going to make you happy and what's going to keep you safe and healthy. So today I just wanted to run through and go over our physical vitality domain. And again, like I said, we have the total of the five the five, my computer's messing up, our five domains. So we will cover our mental and emotional vitality, our spiritual vitality, our financial vitality, environmental vitality, and our social vitality as well. And today we just wanted to start out with the physical, and we might even come back and talk a little more about it. But this is a new year, a new start. We're in the first month, so this is a good time to focus on those physical things and get us going for the year. So until we talk again, enjoy the rest of your day, be safe, and take care.